While many people believe that regular health checkups are always beneficial, the reality is a bit more complex. After reaching a certain age, some common screenings may actually put your health at risk. It might sound surprising, but not all medical tests are as harmless as they seem. In fact, some checkups recommended for older adults can lead to false alarms, unnecessary stress, and potentially harmful procedures. This isn't fear-mongering. It's something that more and more doctors are starting to recognize, especially when treating patients over 70. The medical community is beginning to understand that one-size-fits-all testing may do more harm than good as we age. In this video, we're going to take a candid look at 5 specific health checkups that seniors might want to reconsider. These are screenings that even many seasoned doctors often avoid for themselves. We'll discuss why these tests are so frequently recommended, the hidden risks they carry, and the safer alternatives that can help you stay informed without putting your health in jeopardy. If you're someone who values your health but also wants to avoid unnecessary treatments, over-medication, or the stress of an overwhelming healthcare system, this video is for you. We're here to provide you with knowledge and clarity, so you can make informed decisions about what truly benefits your health after 70. Let's dive in. Number 1. The colonoscopy dilemma. Colonoscopies have long been regarded as a key test in preventing colon cancer. However, after the age of 70, especially for those without symptoms or a family history of the disease, this test can actually do more harm than good. What was once a potentially life-saving screening in your 50s or 60s can, in later years, increase risks and lead to unnecessary stress and procedures. Why is this the case? The procedure itself is quite invasive. It involves full bowel preparation, sedation, and the insertion of a scope deep into the intestines. While this is challenging for younger adults, the risks are heightened for seniors. For one, the bowel prep can lead to severe dehydration and electrolyte imbalances, which can be particularly dangerous for older adults. Furthermore, the sedatives used during the procedure can remain in the body for a longer time, leading to confusion, dizziness, and an increased risk of falls. But the most concerning issue arises when colonoscopies uncover small polyps, often harmless growths that could take 10 to 15 years to develop into something serious, if at all. For someone in their 70s or 80s, these polyps may never pose a threat, yet their discovery can trigger a series of follow-up surgeries, biopsies, and even unnecessary bowel removals, all in the name of prevention. By the time these procedures occur, the risks involved may outweigh the benefits. It's important to have a conversation with your doctor about whether the benefits of a colonoscopy outweigh the potential harm, particularly if you're over 70 and in good health. When the risks of medical interventions outweigh the benefits, prevention can actually turn into harm. I'll never forget a story about my friend George, an 82-year-old man who was active and mentally sharp. He was persuaded to undergo a routine colonoscopy, despite not having any digestive problems. During the preparation, he became severely dehydrated. After the procedure, he was groggy, disoriented, and unfortunately fell at home that night, fracturing his hip. That one test led to months of rehabilitation, mounting medical bills, and unnecessary stress. The worst part? The colonoscopy revealed nothing. This isn't about blaming doctors, they are simply doing what they were trained to do. But medicine is evolving, and it's important that we evolve with it. If you're over 70 and not experiencing any symptoms, it's perfectly reasonable to decline a colonoscopy. There are now non-invasive stool tests that are safer, easier, and effective for many. The key is to truly assess the physical, emotional, and financial cost of a procedure that might not actually benefit you. We need to stop assuming that more testing equals better care. After 70, better care often means fewer interventions and more thoughtful decision-making. Being cautious with your health isn't neglecting it, it's honoring it. Number 2, the full body scan fallacy. There's something enticing about the idea of a full body scan. The idea of having a machine scan you from head to toe, finding potential problems before they become serious, sounds like an excellent form of prevention. But for seniors over 70, this approach can often do more harm than good. The intention behind full body scans may seem like a good idea, but the reality is they often lead to fear, unnecessary tests, and even surgeries that could shorten your life rather than extend it. Full-body CT scans and MRIs are powerful diagnostic tools designed to uncover everything, including small, harmless abnormalities that would never affect your health or longevity. These incidental findings, like a small nodule here or a shadow there, can trigger a cascade of follow-up tests, biopsies, and appointments with specialists. You end up chasing something that may never have been a problem in the first place. Why is this especially concerning after 70? Because the body doesn't respond the way it used to. A biopsy that would have been a routine procedure in your 40s might lead to complications like a collapsed lung or a dangerous infection at 80. Even something as seemingly simple as lying still for an MRI can be physically taxing or painful for older joints. But there's another issue: the emotional toll. Seniors often bear the burden of worrying about potential health problems instead of enjoying the good health they have. Take Betty, a vibrant 78-year-old woman I met at a senior health seminar. She walked every day and had no complaints. But when a mobile clinic at a health fair offered her a discounted full body scan, she decided to take advantage of the deal. They found a tiny lesion on Betty's kidney so small that it hadn't caused any symptoms and likely never would. But hearing the word lesion triggered panic. Within a month, she underwent surgery. The aftermath? Months of recovery, a noticeable drop in energy, and lingering complications that never fully went away. All of this, for something that might have remained entirely silent. Medically, this is known as overdiagnosis. Emotionally, it's unnecessary fear. And financially, it's draining. Full body scans are rarely covered by insurance, and unless there's a clear medical reason, many seniors end up paying out of pocket for what they believe is peace of mind. But what they're really buying is a ticket to a system that might never stop testing. As we age, responsibility looks different. It means trusting your body more, paying attention to how you feel, and understanding that not every shadow on a screen deserves your energy or fear. If you're still finding this information valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, please do, and turn on the notification bell so you don't miss any future videos. Your support helps us keep creating informative content for you. Let's move on. Number 3, the overuse of cardiac stress tests. For years, the treadmill stress test has been the go-to method for detecting heart disease in older adults. The idea behind it is simple: push the heart and observe how it performs under pressure. But after the age of 70, this approach can backfire in ways that many seniors don't realize until it's too late. What was once a helpful tool in your 50s and 60s becomes questionable, and sometimes dangerous, after a certain age. The reason? Cardiac stress tests often result in what doctors call false positives. This means the test may suggest that you have heart problems when, in reality, your heart is perfectly healthy. As we age, our bodies naturally change. Arteries stiffen, blood pressure fluctuates, and electrical patterns in the heart shift, none of which necessarily point to heart disease. But the stress test doesn't know that. It just detects irregularities and triggers a cascade of unnecessary fear and follow-up tests. That cascade can lead to angiograms, catheterizations, or even stent placements or bypass surgeries, procedures that come with real risks. For seniors, these risks are significant. They include bleeding, kidney injury from contrast dye, and dangerous drops in blood pressure. As we age, recovery from surgery becomes more difficult, and complications are more likely. What begins as a simple treadmill test can quickly escalate, leaving you in a hospital bed wondering how things spiraled out of control. Let me tell you about George, a 74-year-old retired bus driver. He had no chest pain, no shortness of breath, and no fatigue, just a routine physical, where his doctor, out of caution, recommended a stress test. The results of George's stress test came back borderline, and before he knew it, he was referred to a cardiologist. 3 weeks later, he found himself undergoing angioplasty for a blockage that hadn't caused any symptoms whatsoever. Within a month of the procedure, George developed a severe infection at the catheter site, ended up in the ICU, and spent the next 6 months bouncing in and out of rehab. His quality of life was never the same. So, was that treadmill stress test worth it? Many leading heart specialists and geriatric associations now recommend against routine stress tests for older adults who aren't showing any symptoms. They agree that if you're not experiencing chest pain, shortness of breath, or unexplained fatigue, the test offers little benefit and significant risk. This is especially true when your aim is not to live forever, but to live well. Psychologically, there's something compelling about checking your heart. After all, the heart is central to who we are. It's the rhythm of life. Naturally, we want to ensure it's healthy. But here's where wisdom comes into play. Healthy aging isn't about chasing every tiny potential issue. It's about listening to your body, maintaining your independence, and avoiding medical overreach that might do more harm than good. That doesn't mean you should ignore your heart health. Absolutely not. But rather than jumping onto the treadmill for a test, focus on the basics: daily walks, balanced meals, staying socially connected, and managing stress. These are the things that truly support heart health after 70, not machines, not wires, and not tests meant for younger people. What we need in this stage of life more than anything is discernment, the courage to decline something simply because it's available, and the wisdom to recognize that not every test is a blessing. Sometimes, saying no to a test can be the most life-affirming choice you make. Number 4. The risks of routine colonoscopies. Colon cancer is unsettling, often sneaking up on people without warning, and by the time symptoms appear, it can feel like it's too late. For years, colonoscopies were hailed as one of the most important preventive tools in medicine. However, here's the reality. Many people aren't told that after a certain age, particularly beyond 70, the risks of colonoscopies may outweigh the benefits. In some cases, this test can do more harm than good. Let's look at the procedure itself. Colonoscopies require full sedation, and for older adults, anesthesia comes with serious risks. As we age, our liver processes medications more slowly, and our brains become more sensitive to sedatives. This puts older patients at greater risk for post-operative cognitive dysfunction, a condition characterized by lingering confusion, memory issues, and brain fog that can persist for weeks or even months after the procedure. Then there's the bowel preparation. If you've ever had a colonoscopy, you know just how difficult this process can be. The colonoscopy prep involves drinking large volumes of powerful laxatives that flush your system. While this process is necessary for the procedure, for seniors, it can be incredibly dehydrating and disruptive. It throws off your electrolytes, affects kidney function, and can leave you feeling physically and emotionally drained. One wrong step and you're dizzy, weak, or even at risk of falling often in the middle of the night in the bathroom. And this is not just an exaggeration. Falls related to colonoscopy prep are more common than many realize, especially for seniors who live alone. But perhaps the most overlooked issue is this: the time frame for benefit. Colonoscopies are designed to detect slow-growing polyps that might take 10 to 15 years to develop into cancer. However, if you're in your 70s or 80s and have had previous clean screenings, the odds of those polyps turning into something dangerous during your remaining years are extremely low. In fact, many medical associations now say that the potential benefits become marginal after a certain age, while the chances of complications such as bleeding, perforation, and adverse drug reactions increase significantly. Take the case of Eileen, a 78-year-old retired school teacher. She had a clean colonoscopy at 68 and again at 73. But at 78, her doctor recommended one more just to be safe. She agreed, and during the procedure, her colon was accidentally perforated, a rare but serious complication. Eileen had to undergo emergency surgery and spent nearly a month in the hospital. She survived, but her energy was never the same, and her independence was greatly diminished. Eileen often reflects and wishes someone had warned her that the test might not have been worth the price she paid. Why does this happen? Part of it is medical habit. If something worked well at 50, it's assumed to still be effective at 75, right? But aging changes everything. What once protected us can later become a burden, and while the fear of cancer is valid, it often leads people to overlook their true priorities at this stage of life: staying mobile, mentally sharp, and emotionally well. No screening test, no matter how advanced, is worth sacrificing these essential pillars of well-being for a marginal increase in longevity. What truly matters at this age is being alert to actual symptoms, such as unexplained weight loss, persistent abdominal pain, or blood in your stool. If you experience any of these symptoms, yes, further investigation is absolutely necessary. But if you're asymptomatic and have a solid record of previous screenings, a routine colonoscopy may not only be unnecessary, it could even be dangerous. This is where we must reclaim our agency. Being informed means understanding the trade-offs and making decisions based on what's best for your body, not just following the routine because that's what you're supposed to do. Your body has earned the right to be treated with care, not subjected to risks that no longer provide proportional benefits. If you're still watching and finding these insights valuable, please comment number 4 below to let me know you're with us. And if you haven't subscribed yet, I recommend you subscribe and turn on the notification bell so you don't miss any future videos. Your support helps us continue creating valuable content to inform and inspire you. Now, let's move forward. Number 5. The overuse of routine cardiac stress tests. Heart disease is often seen as a ticking time bomb. We've all heard stories of someone who seemed perfectly healthy one day, only to collapse the next. Naturally, we want to catch any heart issues early, which is why cardiac stress tests, whether treadmill or chemical tests that monitor your heart under stress, have become so common, especially among seniors over 70. But here's the surprising truth. For many older adults, especially those without any cardiac symptoms, these tests can do more harm than good. The idea behind a stress test seems reassuring. You walk on a treadmill, they monitor your heart rate, and if something unusual pops up, they take action. but the reality is more complicated. As we age, most people experience natural changes in the cardiovascular system-mild artery stiffness, some plaque buildup, or slower recovery after physical exertion. These are often just normal signs of aging, but when these changes appear on a stress test, doctors might interpret them as serious concerns, leading to further testing or unnecessary procedures like angiograms or stent placements. That's where things get risky. These follow-up procedures aren't without their risks. Catheterizations, for example, can lead to bleeding, stroke, or kidney damage, especially in older adults with more fragile blood vessels and reduced kidney function. Once you start down that path, it's hard to turn back. One test leads to another, and before you know it, you've undergone a series of interventions for a condition that may never have caused you any issues to begin with. Take Harold, for example, his 76-year-old grandfather from Illinois. He was in great shape, walking daily, playing with his grandkids, no chest pain or shortness of breath. During his annual checkup, his doctor recommended a stress test just to be cautious. The test showed a minor abnormality, which led to a cardiac catheterization that revealed some non-obstructive plaque. Despite this, the doctors decided to place a stent. After the procedure, Harold developed a complication from the blood thinners, ending up in the hospital with internal bleeding, and spent the next 3 months recovering. All of this from a test he didn't need, based on a condition that wasn't urgent. So why does this happen? It often comes down to fear. Fear of missing something, fear of the consequences if we don't act. But at this stage in life, it's important to focus on quality of life over quantity-preserving energy, independence, and comfort instead of chasing problems that haven't even appeared. Many respected cardiologists now advise against routine stress testing in older adults who don't show symptoms. The evidence simply isn't strong enough to support it. It doesn't prevent heart attacks. It doesn't lower mortality rates. And for those who don't experience active signs like chest discomfort, shortness of breath with minimal exertion, or dizziness, it's not just unnecessary, it can actually be dangerous. The smarter approach is symptom-based care. If you're noticing changes in how you feel during physical activities such as fatigue, pressure, or a racing heartbeat, and yes, it makes sense to get evaluated. But if you're feeling steady, sleeping well, and staying active, your body is already telling you a more accurate story than any machine can. As we age, the focus should shift from aggressive intervention to thoughtful observation. It's not about giving up, it's about living wisely. You don't need to fight every potential disease. What's more important is protecting your time, your clarity, and your dignity. Final thoughts. Growing older doesn't mean growing helpless. In fact, it's the time when we're finally wise enough to question the system, to slow down and ask, is this really for me? In a world that glorifies more checkups, more screenings, more pills sometimes, the bravest choice is doing less. And not because you're neglecting your health, but because you understand it better. You know your body, your values, and your goals. At this stage in life, healthcare in your 70s and beyond should not feel like a conveyor belt of automatic tests and impersonal routines. It should be a conversation focused on what truly matters to you, how you want to live, and what risks you're willing to take. Blindly following protocols designed for younger bodies can deplete your energy, rob you of peace of mind, and even shorten your life, not because the doctors intend harm, but because they're working within a system that often chases disease rather than honoring the natural process of aging. If this video made you pause and reconsider, if it provided a new perspective on your health, then it's already done its job. And remember, saying no to certain tests doesn't mean you're ignoring your health, it means you're being deliberate. You're weighing the benefits against the burden. You're acknowledging that not every test brings clarity. Some lead directly into the maze of overdiagnosis, anxiety, and unnecessary treatment. So take ownership of your health. Have open conversations with your doctor. Ask whether the test will genuinely impact the outcome or if it's just paperwork. Think about your time, your energy, and your comfort, because at this stage, those things are precious. You've earned the right to live life on your own terms, not out of fear, but with thoughtfulness. Not overloaded with procedures, but empowered with knowledge. You deserve to live actively, creating a life full of meaning, joy, and connection. Thank you for joining us today. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to apply it in your life. Your thoughts are important to us, so please don't hesitate to share them. Reading your comments motivates and encourages us. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us continue creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.